Hi, this is Dr. Adel from Naperville Family Dental Care. Today's video log is about oral cancer. There's been a lot of studies and surveys that have been done in the past few years. One of the surveys that came out was a very interesting one. It was about the number of dentists, the percentage of dentists that have been surveyed by patients who actually do a thorough oral cancer screening. And the number was quite staggering. It was about 1% of the dentists actually do a full oral cancer screening, which includes checking the glands underneath the chin, inside of the mouth, looking at the inside of the lips, looking at the roof of the mouth, looking at the salivary glands or spit glands in the mouth, as well as the tongue and the back of the throat. Most common places where we find oral cancer are in the tongue, roof of the mouth, and inside of the cheeks. And we've also found that even that 1% that do check for oral cancer, they still miss over about 69%, anywhere between 40 to 69% of those potential cancerous lesions. Now, not everything that we find in the mouth is cancer. Sometimes it's just a cut, sometimes it's just a burn on the roof of the mouth, but we do want to make sure that it's not cancer. So what can we do? Well, our eyes are only as good as our eyes, and many of these cancers are actually forming below the surface, and there's no way we can see them with the naked eye. Well, now we have better tools and better instruments to actually check and find out if there is something that is not quite right. One of those instruments that actually I use in my practice, I do a visual exam, which takes about 3 minutes anyway, but I also do another 3-minute evaluation for patients, and we use a machine called Velscope, which is this little machine right here. It's actually a blue light. When we turn it on, it emits a very intense blue light. We give patients a nice set of goggles so it doesn't bother their eyes. It does not harm the tissues in the mouth, and it works beautifully. The way it works is that it shines a blue light in, and those lesions or those areas that could potentially be cancer or have issues tend to rebound the light back to us, and we look through the back of this and we see something that looks green, and that green area tells us there's no problem. Now, if there is something that is a problem, like a cancerous lesions, it absorbs or sucks all the blue light in, and it turns kind of black. It looks like a black hole, and when that happens, it looks black, not green. Makes it pretty easy for us to see. Studies show that when we do use this, we miss about 10% as opposed to 40 to 69%. By the way, that 40 to 69% talks about 40% in the specialists who were tested, like the oral surgeons and the oral pathologists who have more trained eye, and they do spend a lot more time with patients when they're doing an evaluation versus a general practitioner or general dentist like myself, who spends on average about 10 minutes with a patient. Now, most of my patients know that I spend more than 10 minutes with them when I'm doing an examination and I'm doing a cleaning and I'm doing a procedure with them, and that's very important. We do need to spend more time looking. However, this will help us do a much better job. So if you have any questions, give us a call at 630-369-8950 or shoot us an email on our Facebook page. That'll be great. Take care.